Trauma is an epidemic in society today. It accounts for about 150,000 deaths per year in the United States. It's the leading cause of death for citizens in the U.S. that are under age 45. The Elvis Presley Memorial Trauma Center is the only Level 1 trauma center in the western half of Tennessee. The Level 1 Trauma Center is an institution that meets specific criteria that are set forth both by the state and by the American College of Surgeons Committee on Trauma. But we take those patients who are injured because of societal issues, whatever they may be, we come here and that's their best shot of surviving and getting home.
So we first receive a notification of an injured patient through our pre-hospital communication system. The chief resident on the trauma service receives a report on the patient, and then based on that report and the patient's vital signs and injuries, they choose whether or not to make that patient a shock trauma or not. When a shock trauma is triggered, you get an entire team that's available to that patient immediately. That includes one trauma surgery attending, a trauma surgery fellow, 4 trauma surgery residents, 1 orthopedic surgery resident, an entire operating room team, 2 shock trauma nurses, 1 shock trauma tech, radiology, a CRNA, an anesthesiologist, a respiratory therapist, pharmacy, chaplain, from our nurses to our techs to our respiratory therapists. Without the team, we would not be able to care for these patients. And we follow these patients through the shock trauma bay, into the operating room, into the ICU, ideally onto the floor, and then out of the hospital. It's unbelievably exciting and rewarding to see a patient who comes in here with an injury that's threatening their lives and they're able to walk out. It's for the patients and for the patients' families is why we do what we do.